today, Patrick and I are going to talk about, is 2022 the best time to start your own business? Going from 21 to 22, we're going to talk about, is it the right time? Should you wait? What are other people doing? We're going to talk about all of that this afternoon. Let me share a little bit with you for those that are brand new to any of our webinars. Again, my name is Eric Auger. I am here to help you through some of your processes, your due diligence as we go through some of these webinars. APS has been around on 27 years, and gosh, we get to change this in another 30 days here to 28 years in business, folks. You know, if there's been a business that has gone through recessions and pandemics and anything that's coming down from Medicare and people asking, are we going to go to a one-payer system and anything going on like that, folks, this business has been through it and is still here today. So if you're looking to be part of a business model and a business system, and you've been looking at different franchises and different business opportunities, obviously you want one that has some stability and some longevity, and American Business System is that type of company. And so do we always do everything correct? Not always. But that's what happens over 30 years of being in business, folks. But we do everything that we can to make things right for all of our business owners and give them the best opportunity to get started with everything that they need to get started with. So folks, again, being around a business opportunity like American Business Systems, again, whenever I met them over 15 years ago, they were blowing and going then, and the future looks great. So if you're looking to be a part of a certain business opportunity or franchise, I'd tell you, don't look any further, because this is the one that you need to be kind of looking at. And why is that? Well, we've got the system down. Not only do we have the system, we have all the software that you're going to need. Everything is in the cloud, so it's very modern, and you don't have to worry about CDs or DVDs to load on your computer, and you go find out where to load them on your computer, and you find out your computer doesn't have a DVD player anymore. Folks, listen, that's just where we are. You need everything is what we have here with American Business Systems. And not just with the platform itself, but all the different services and the accessories that go along with this. The auxiliary services, a virtual care, an audit guard, and code write, and compliancy guard. And now we have a dental program that if for folks that want to do dental billing, folks, I believe we've got it all covered, and we're still adding other services to the platform. So, and that's all at no additional fees. Yes, there's no additional fees that you're going to have to pay for those. That all comes with you. Now, let me introduce you to the founder of American Business Systems. That's Patrick Phillips, and Patrick is going to be joining me here just momentarily. But I'd like to share a little bit about my friend Patrick. Patrick and I, and Linda and his wife, and my wife, have taken vacations together and enjoyed just time together. And so he's just been a wonderful friend. But he is a great author too. He's written some great books in the past, and is still encouraging others to write. He's encouraged me to write a book, and I've got it, and it's just still sitting on my computer. Haven't gotten it out there to get it done yet, but just a wonderful friend. But again, a motivational guy, and I'm so pleased to be joined by him this afternoon. He's been on the board of the editorial board for Building and Coding magazine, and folks, I'm going to tell you, without any further ado, I'm going to ask Patrick to join us. Patrick, it's good to see you, sir, and happy Thanksgiving to you again.
Yes, same to you. Hey, Eric, I'm just amazed at how many people don't even know that we, have an organization that I helped found called the Medical Revenue Management Association of America. That's a mouthful, isn't it?
It is.
If you want to go check that out, folks, it's right there on the screen, MRMA.org, we call it. And you'll find out that we have a lot of people in this industry, in the medical billing and coding industry, that are a part of our advisory board. And so again, we established this several years ago so that we could have an organization that actually certifies the people who go through our training. So we'll go into that a little bit more detail. I know some of you are still, if you're new to this, don't really know what we're talking about yet, but we're going to cover just every aspect of this. And Eric, before you go to that next slide, which is just us, Now see, we got us and a slide of us. There you go, folks. If you don't have enough of Patrick and Eric, we can put some more pictures up there if you want them. But why don't you show them that video that we just got from a lady who just went through our online training.
I
Her name is
certainly will.
Chelsea. Chelsea is her name, Chelsea Brown. And this is just a little short video that she made. I thought it'd be interesting to see what she says.
ABS's training on medical revenue cycle and practice management systems was very comprehensive. The marketing training was excellent. I have several highly specific marketing strategies that makes me confident that I can succeed in this business. Cynthia Anderson did an excellent job of answering any of my questions and helped to make sure that I understood. If you have the ability and the time to start this business, don't hesitate, do it.
There you go. Well, folks, we just wanted to show you that because basically when you go through our online training, you'll have the opportunity to learn everything there is to know about this business. We'll go into that a little bit more detail later, how that works. But basically, you're actually online using Zoom, talking to our instructor, a live instructor, just you and the instructor, or if you wanted a friend or a spouse to join you, they could do that too. And we go through every aspect of this business in detail, so you don't have to have any background whatsoever. Eric, would you say some percentage of our licensees have no background whatsoever in the medical field? It's way up there, isn't it? 95%. Maybe.
Yeah, it's very, very high there. And so obviously, and we've done webinars on, do you have to have coding background or medical billing background, or do you need to have any type of medical background at all? And you really don't, because if you've got an entrepreneurial, fever in you, and you're trying to find a business that's sustainable and can go through recessions and pandemics and everything else, this is the type of business that anybody should be looking at.
Yeah, I mean, we're going to show a little video later. One of our licensees actually tells of his experience in out marketing in this this pandemic, and so you'll see, folks, it's actually almost better for our business because everybody gets more tuned in to the needs of people and their health. As long as there's human beings, Eric, I don't know how this business would ever slow down.
Absolutely. Yeah. Hey, let me remind everybody over in the chat area, Patrick put the slide deck of today's presentation over there. And if you want to go check it out, go over there. You may have to scroll up to the top. If you don't see it, just chat us over there and make sure that you say either it's there or it's not there. Just make sure that it's there. But sometimes as people kind of get logged in, you may miss it being at the very top there.
Yeah, I can drop it back in there too if there's some reason it doesn't show up. But somebody will let us know. Nevin's on here. Nevin, why don't you go up there and see if you can download the PDF of the slides, and if you can, just give us some feedback there in the chat window.
Patrick, as I was putting today's webinar together, I was really thinking from really kind of stepping back a little bit and asking a question to myself. Okay, if I'm going to be starting a new business from 2021 to 2022, what are some of the questions that I have? Well, just as a businessman, obviously, we have gone through a pandemic and it's still lasting and it's going to be around. So I think everybody understands that. Now we've got some inflation going on. I mean, it's costing a little bit more to buy the turkeys this year. So what do I want to do if I'm looking at a year from now? Where do I want to be a year from now? That's some of those questions that we need to be asking. And so what I came up with was a question that I've got here at the top of the title, at the next one, or not really a question, but I said it's time for your pandemic business plan 2022. So
there's some businesses, Eric, that I would not even think about opening right now. I wouldn't open a sandwich shop even. I mean, if you think about it, even a sandwich shop, some of them are closing down because you had the mandates going on with the masks and so forth. I've seen restaurants that I never thought would shut down.
Right.
But anyway.
But
Nevin says he's on his phone and he can't see. He doesn't have his glasses, so he can't see.
Well, here's some information that I want everybody to grasp. And so you and I go digging for news articles and some of the things that can help you make your decision. And so I found this one. It's on LinkedIn News, and those that can download to today's presentation, you'll see this, that you can see the top 3 industries that have the most entrepreneurs in it is healthcare, and 8% of all entrepreneurs are in healthcare. And I love to see what this guy David Cohen has to say, and who is he just says healthcare has become an especially fertile area for founders this year. Says startup champion David Cohen, who is a managing director of Techstars, a new company accelerator. And he says it's an industry that traditionally has been resistant to new technological pathways, he says. But this year, with the pandemic enforced switch to remote work, we've had to do healthcare online, he observes, that has broken down resistance to new tech-centered ways of addressing medical needs. Patrick, that one of the things I want to point out here that we're not really going to showcase much on today's webinar, but besides medical billing, one of the avenues that our business owner entrepreneurs in healthcare can assist doctors is in what's called remote patient monitoring, or what is called healthcare online. Patrick, I mean, I can't think of any other business opportunity that gives you the freedom to kind of pivot as you need to, as what ABS has.
Well, and with our cloud-based system, of course, we really are tech-centered. We in fact, we're probably the most advanced technology that's out there. Everything that our licensees do right now is completely online, and that includes even meeting with doctors online. You don't even have to go to their offices. They would sometimes rather you do that. So there's been a real blessing in that people have learned how to use online conferencing to have meetings and not have to meet in person.
Right. And I tell you what's been great here is with getting really good at being on Zoom. You know, you can have meetings with hospitals that you never thought you could get involved with, or large medical groups that you never thought you could really be a part of.
Right.
So the technology out there, folks, gives you a lot of marketing force if you'll use it. That's the thing. You've got to, you know, a lot of people, I remember, I kind of call it the old days when you know, you would go out and almost door knock and go see people. Now you can invite people to a webinar or a little briefing, and people are interested, and because they can't get out either. I mean,
well,
so.
No, that's right. And we've changed our entire training, Eric. As you know, we used to do that here live. In person at a hotel here in Dallas. People would fly in for a week and so forth. We figured out even before the pandemic, the year before that, we decided, let's just move to completely online. We still have a live instructor that you're able to ask questions to and interact with during your training, all 15 hours of that online training. But you don't have to get in a plane, you don't have to travel, you don't have to do anything other than just show up on the Zoom and talk to them, just like you and I are talking right now.
Absolutely. So, you know, whenever I was putting all this together, let me put that screen back up there. I clicked on the wrong button there.
No, there we go. I got to see myself, bigger on the screen.
Yes.
I like
that. Whenever I said it's time for your pandemic business plan for 2022, I said here, don't begin 2022 falling into the trap of using COVID-19 as an excuse for not getting things to happen. Do the opposite. The pandemic could be an excellent reason to get your work up to speed.
Yeah, let this be a wake-up call, folks. That's what it is. For you, if you haven't got your own business, and you've been laid off from another job, you know now that there's no security. There's no security in having a job,
right.
just over broke, right? You need to be in your own business where you're in control of your own future. And Eric, the folks who've gotten into this business have seen very easily that they can build this thing as big as they wish it will go on forever. There will always be a need for doctors who need help in collecting that money from those dang insurance companies.
Exactly. Exactly. Also, the pandemic has opened up new doors to products and services to promote in the market. If you belong to the large group of people who lost your job during the pandemic crisis, starting your own business might be the best bet ever. So, Patrick, we started this whole this today's webinar in is 2022 the best time to start your own business? And I'm going to shut off the slides here just for a moment. And Patrick, I mean, you've been at this business of marketing, and you've been through recessions. You've been through the days of where CMS has come and said we possibly might go to a single payer. Why don't you just give a little chat? If you were just coaching these people one-on-one, what would you tell them about going into 2022?
Well, I would relate it back to even the 2008. The recession started back in that time period. And Eric, you and I even wondered, well, what's that going to do for our business here? And actually, it boomed, as you'll see here in just a minute, folks. There's lots of businesses that you know by name that started during that period of time. And when they did, they prospered. Now, why is that? Because it is a time of challenge. And during times of challenge, that means that some people are going to really excel because they want to be, successful in business. Well, this is a business that, again, as long as there's human beings that get sick and go to a doctor, and the doctor has to get paid by somebody, someone has to bill that entity, the insurance company or Medicare, to get that money to the doctor. And we just happen to be the experts at that. We can reduce their rejections on the claims. We can increase the time, and reduce the time that it takes to get the payment and increase their revenue. That's the bottom line, is we bring in more money. Our licensees, our business owners bring in more money than the doctors have ever seen. And some of them are just thrilled when they see what we can do for them.
You bet. Let's get back to the slides here just real quickly, because one more thing that I did find here that I found very interesting, Patrick. Again, whenever I said it's time for your pandemic business plan 2022 from Salesforce. Now, folks, if you don't know who Salesforce is, this is one of the big companies that's out there that kind of helps you kind of get things going, and they've got all different types of business sorts of things out there to kind of monitor all of your business people that you're working with. But Salesforce came out and says entrepreneurs started businesses in record numbers during the pandemic. Patrick, I know you love that first sentence. I'm gonna let you read that.
Yeah, it says it's true. Recessions in the United States are typically marked by increases in entrepreneurial activity. But last year was special when COVID-19 forced furloughs and layoffs and business closures. People responded by starting small businesses in droves. So it proves, Eric, that again, when there are challenging times, people step up and realize this is my opportunity. This is it. This is the thing that's forcing me to get into business for myself. So folks, again, look at this. According to the Census Bureau, more than 4.4 million new businesses were created during last year, the highest total on record. That's a 24.3% increase. There you go, from 2019, and a 51% higher than the 2010 through 19 average. 500,000 new businesses were started in January 2021. This year alone, 500,000 new businesses. And data from our most recent B2B survey shares how and why new small business owners took the leap over this past year, and why many may reap the benefits. So again, folks, this is not us talking about, this is Salesforce, and they know what's happening out there because, well, they've got a whole lot of businesses that are part of that.
You bet, you bet. So if you're looking to even think about starting a business, now is a good time. Don't let all that, what happened, deter you. We're encouraging you now. If you're looking at it, now's the time to kind of start getting your what you need to get going here. I think, Patrick, this is the gentleman that you wanted to share again. We got another quick little video here, so we're going to see if we can play that. You want to explain what this video is about here real quickly, Patrick?
Yeah, this is basically started his business right at the beginning of the pandemic, like last year, the beginning of last year. He was right in the middle of it, basically. And he went out and figured out how to market to doctors using some of the tools that are unique to ABS. So this is just a couple of minutes. So take a listen to this, folks, and tune in real carefully, and you'll see that he was very successful using some of those tools, and he'll show them to you here.
We had to figure out the new marketing paths with COVID-19, but you know, we've done that. So
yeah. Well, I know that you're using our book, The New Thriving Medical Practice, because well, there's a copy right there with your name on the front cover.
right. I've actually got one. I don't know if you all can see, but I've got one right here in my hand, and there's my name right on it. So you can see that. But this book actually has been a great tool because I sent this book to an orthopedic surgeon who called me and read the book. A gastro as well called me, gastroenterologist, because of this book, and then also sent it to a dermatologist who's looking to grow his practice. And we went down and had he called us, or his office administrator called us, and we went down and had a face-to-face. But yeah, so we're making headway, and it's just changed the dynamic a little bit in terms of how you market. And fortunately, ABS was ahead of the curve, not knowing, of course, that there was a pandemic coming, but in providing multiple tools, different ways, different paths to marketing. And so this book has been really good for us because you have to nowadays get yourself invited into their space.
Mm. Yeah, so you said that you had just basically mailed the book out to 2 or 3 doctors with a handwritten note.
Yeah, that's what I did. So let's talk about the dermatologist. I had never met him before. I saw online, I was doing a little research. I found this dermatologist and looked at their website, and I happened to see that they were hiring for somebody to do inside billing. And so I thought, okay. So I took out my book and put a little handwritten note in there and stuck it in an envelope and sent it to him. And, a couple months went by because I did that pretty early, I would think. It was before the pandemic. But once the pandemic hit, I think, there's a realization now with these doctors, like, oh, geez, my billing staff can't come into the office. I'm losing patients. There's all of a sudden a realization that there's trouble.
Yeah, there's trouble. In other words, the trouble is that he couldn't get patients to come into the office. He couldn't even get his staff to come in, the ones that were doing the billing. And so doctors are struggling, Eric. Some of them are really struggling to get their practice back to the revenues that they saw in 2019.
Absolutely. And so, folks, if you have, here's a good thing. People like Dan that you just heard, we've got a list of folks that you can talk to, of ABS business owners, that if you haven't taken the time to talk with some of these folks, and we'll talk a little bit about that towards the end of the webinar today, of what you can do to take some steps, some proactive steps to get started. Talk to people like Dan and others who's got their practice up and going of medical billing, just by utilizing the marketing tools that we teach here. So again, Patrick, I come back to the question, is it ever a good time to start a business? It's almost like when you get married. Is it ever a time to have children? And you go, oh, I don't know, but it is. It's a serious question. Is it ever a good time to start a business?
Well, and the ones we're going to talk about here are all businesses that were started during slowdowns or recessions in their period. Like back in 1837, Procter & Gamble started, and there was a real slowdown in business. Well, you've probably heard of Procter & Gamble. They own most of the products that are in the grocery stores, especially cleaning products and things like that. Who hadn't heard of Procter & Gamble? Then there's General Electric. You've heard of them, right? This was in 1890 when they actually started in New Jersey, their business. And of course, they're one of the largest manufacturers of, appliances in the world. So how is it that people like Ford Motor Company in 1903 started in 1903? That was a real tough time economically. Again, we've done our research here and went back in time to find out what was happening in 1903. If you do that, you'll find out that they were really struggling, most businesses back then. Even IBM in 1911 started in a very hard period of time there. Sorry, I had to cough there, so I'm muted.
Yeah.
And Disney in 1923. Again, folks, these were really rough times that these businesses started their business, and yet they boomed. I think the last one here is Toll House Cookies, one of my favorites.
Of course.
Nestle's Toll House Cookies, and that was back in 1933. So again, folks, it does not matter what's going on. In fact, if it's a hard economic time, sometimes that's the best time to start a business.
And you're exactly correct, Patrick. And we go, people are going, well, gosh, that was during those times and those times of recessions, and this is a different time now. Listen, there's never always ever a good time. You might think about starting a business, but are you going to wait until either another, scare comes around like the pandemic that we just went through, waiting for that right moment that you might think could kind of get some things started here. So now is always the right time to start a business. Matter of fact, I went even down to Tony Robbins' website, and he's got, and I put the website down there. So again, if you want to go research this, what businesses do well in a recession. And look at the first thing. He says, businesses that thrive in recession are usually in essential services like healthcare, senior services, grocery stores, maintenance, such as plumbing and electrical. And so he listed number 2 on his list, healthcare, like groceries. People need healthcare to live. That demand doesn't decline when the economy does. Healthcare is always inelastic, meaning the demand for it doesn't change based on its price. So folks, you can see that healthcare, you want to be in healthcare some sort. And obviously you can't maybe go back and become a doctor or a nurse or anything else, but what you can get involved in is on the financial side, the coaching side, the remote patient monitoring side, the virtual care side. Whatever you want to be involved in, now's the time to be involved in that side of healthcare. All right, let's get to the next. I think I clicked on the wrong button there. So let's get to here. Okay, so let's talk about some of the reasons why you might want to get involved with healthcare. Patrick, what does it mean whenever doctors are in pain? What does that mean? I think you're still muted.
It means they're struggling not only to get more patients in, but to actually collect the money that's due to them. Because again, their staff, you see, the limited staff that some of them have to focus on the patients, and they don't spend the time that they used to spend on the billing. If they've been doing the billing inside their own office, believe me, those are the doctors that are struggling the most, Eric. We actually increase a doctor's revenue. Even though it costs them some money, they pay a percentage, of course. For every dollar collected, our licensees are making a percentage of that, somewhere between 6 and 8% usually. That costs them a whole lot less than paying the staff to spend more time on the billing. And some of them are even wasting, like this slide says, 24 cents out of every dollar is wasted on administrative and billing expenses. Think about that, Eric. That's 24% of all of their revenue just wasted. They should be spending it on helping them to market their practice.
And folks, how is it wasted and why is it wasted? It can just be simply as anything from getting behind on billing, trying to get an increase of dealing with more patients, patients not showing up, claims that come back not paid, running down old claims. There are so many things that happen, and imagine them just trying to practice medicine. Patrick, again, it seems like every week I'm talking to a doctor who say, the way that medicine used to be, you just can't spend the time with the patients. And I'm one of them. I go to the doctor, I want them to spend as much time with me as they can. I have to tell this quick story here. I went to a doctor a couple of weeks ago, and she kept looking at her watch and kept looking. And then finally she goes, well, I've got 5 more minutes with you. I wanted to go, Are you even listening to me? I mean, are you going to put that stethoscope and listen to me at all?
I can
Because-
identify with that. You know,
Yeah.
I've joked about this, Eric, but you and I are learning this from experience that as you get older, parts stop working. You know, your parts in your body, and different parts need more attention. So you go to the doctor more, right? That's another reason why this is a great business, is because the baby boomers that are out there are retiring at the rate of 10,000 people a day
Yes.
into the system. And that means that they have more time to go into the doctor's office, and they want to spend time with the doctor. You're right. The doctors are limited, though, on the time they can spend.
Talk to us about Dr. Vicki Wagner. We're going to talk a little bit about her, but this particular book, The Myth of the Rich Doctor, I think we all have that myth or that thinking that all doctors are just very wealthy.
Right. And look at this. She says in this book, Eric, that physicians in private practice are something about, we got the wording wrong there, I think, from an average, they walk away, that's what it's supposed to say, from an average of 30% of their incomes when they do not follow up on rejected insurance claims. Now, people probably know that sometimes insurance companies look at a claim that's sent in and go, for some reason, we're not going to pay this. Well, it sometimes is up to 30%. So for a doctor, that's a huge chunk. Yes, at the end of the year, they can write that off, you know, on their taxes. But believe me, doctors would rather have that in their bank account. And our system, of course, can get that rejection rate down as low as 2%. Eric, I read the other day that our system, our licensees are seeing less than 2%
Wow.
rejection rate. So that's more money, you see, to put in the doctor's pocket. So folks, it's just like selling popsicles out in the Sahara Desert. Doctors want more revenue, and you are the guy that can provide it.
Let me share with some people what a rejection rate is, just real quickly, so that, you know, we got some folks that maybe don't even know what that means. Okay, it's simply as this. You as a biller, or the doctor's office as their biller, sends that claim to whatever insurance company, and it has to go through what's called a clearinghouse. It could be rejected at the clearinghouse and sent back to you as the biller. And sometimes it'll just kind of come back and just sit on your desk and never get rebilled.
Right.
Or it makes it through to the clearinghouse and to the actual insurance company like Medicare or Blue Cross Blue Shield or whoever it might be. And then they reject it for whatever reason, because their software didn't catch the errors that should have been caught, like ours does catch. And it gets sent back to the biller. And again, it sits on the desk or sits in their computer system and doesn't get that. That's what Dr. Wagner is saying, is that losing up to 30% of their income just because of rejected insurance claims happens more than what you think. And that's really just what it's all about there, of our system being able to do things that are even better than that. And you talk about denied claims. I mean, we're talking from the U.S. Government of Accountability Office. They say that it can range anywhere from 6%, Patrick, up to 30% of claims that are denied because of whatever reason it might be.
Yeah, and folks, that's nothing to sneeze at. Think about if you owned a business and you were billing $100, but you only collected $70. $30 were just, you know, down the drain. Basically, you could not collect that from your clients. That is a huge reason why a lot of doctors are struggling right now, and we can solve that for them.
Now, we put this information in here for your due diligence. And as you can see, if you can go download the slide decks and you want to go look this information up, you certainly can. This is not numbers that Patrick and I are making up. This is from governmental, and this one it's called the HBMA. It's one of the largest healthcare organizations out there, associations out there. They say it's not unusual to have a 35% or higher claim rejection rate. Which requires extensive and expensive follow-up. Again, just imagine all the follow-up that happens. So you're maybe some of you are asking the question, you know, that New England Journal of Medicine says, you know, 24 cents of every dollar basically is wasted upon something. This is what it's wasted on. So we're expressing to you and sharing with you this data that you need to know to go whether this is a valid business or not. And some doctors know this. I'm going to tell you, Patrick, a lot of doctors don't even know this. They're barely doing what they can to just to survive.
The doctor has to focus on the patient side of his business, right? There is a business side to a practice that they don't spend the time or money because they weren't taught, they weren't trained how to help their practice, be profitable. And they're not business people. Anybody who's worked for a doctor will tell you that they are the worst business people out there. That means we are the ones that can step in and solve that revenue problem that they're having and actually save them money. That it doesn't cost doctors to do business with our licensees.
No, yeah, it doesn't cost them that. Yeah, it actually costs them if they don't. That's the big thing.
Yeah.
And then the time of getting paid. Normally it takes about 30 days to get a doctor paid, but some doctors are not getting paid their payments as far as 90 days, 180 days. Sometimes even a year before they get their money.
And we've seen licensees tell us, Eric, that they've gotten payment within the same week. They billed the insurance company on Monday, had the money in the doctor's bank account on Friday. When we tell a doctor that, of course, it's hard for them to wrap their brain around that because they're so used to these 30 to 90 days payments. So they love that because the faster a business can turn over their cash, the better.
You bet. Folks, just to let you know, we've got about 20 minutes left of the webinar. Feel free to ask us any questions. If there's anything that comes up in your mind or anything you'd like to ask us, Patrick and I will do what we can to help answer that question.
Yeah, there's actually a little Q&A button at the bottom of your Zoom window. If you hover your mouse over it, you'll see it down there. Just click on that Q&A and type it right in. You can even type them in anonymously if you want to, but we will not read your name out. We'll just read your first name, and we'll address those questions live today. Yeah.
You bet. Now, the first reason is, is this a good business to get started? As you're kind of doing your due diligence, obviously, whatever you're trying to figure out, obviously, Patrick and I shared with you the number one issue with doctors. They've got pain. We showed you what the pains are, and doctors need a remedy. They need a remedy of themselves. So how do you discover what their remedy can be? The last thing you want to do, and the last thing Patrick and I want to encourage you to do, is just to go out and say, hey, doctor, I know that your business is really going into the toilet, and I'm here to help you. No, that's not the way to do it. Nobody likes to say, hey, you're falling apart here. I don't like to go to the doctor, and the doctor tell me that. I want them to, I want to say, you know what, you're looking pretty good, but there's a few things we might need to tweak here. And that's what the practice analysis is all about. That's what we want to share with you.
Yeah, you can't go out there and tell a doctor that you have solutions to problems that they don't even realize they have. So what we've taught our licensees to do, and we developed over years of experience, a questionnaire called a practice analysis. Basically, you sit down with the office manager. Usually they have all the information that you need, and you just go over these questions. And by the time you finish this questionnaire, which takes 15, 20 minutes, it basically tells you if they do have a problem. Now, you don't try to sell anything there. You basically go back home. You can do this over Zoom, of course, as well. You go back to your office and you create a report that's going to show them exactly the kind of money that can be saved. And Eric is showing a copy of one here. That's just a thing we made up, I think. But anyway, it's based on real numbers that we get from our licensees. As you can see in this doctor's instance, look at that bottom line down there, folks. We can increase the revenue for this practice by $122,000 a year. Now, let that sink in for a moment. For a doctor, that is the down payment on a nice car.
Yeah.
A Tesla.
Yeah, there you go.
Yeah. And so you basically save the doctor money because of the fact that you can reduce their rejection rate so drastically. They're just banking more money. That's what bottom line is.
I think we kind of finally shaken the trees a little bit for some questions here. And Joan's asking, when you say that you can solve claim denials, how are you solving that? By entering in the correct ICD codes? Joan, yes, actually our software actually makes sure that you are billing the right ICD codes, because the codes are already all built in there, especially if the doctor is using our EMRX program and they're doing their what they need to do, their examinations utilizing that. It's going to actually help coach them to make sure that they're utilizing the correct codes there. So yeah, that's how it's done. It really is that easy. And then someone's asking, how do you get the clients? Does this training train us to market the business? I'm not sure when this person was on the webinar, but maybe if you go back and listen to it again, you get to hear Dan say, hey, this is ABS taught me how to utilize the book. We're going to show that to you here in just a moment of how to market those to get to your first client here. We know that's the most important part for you, is how to get that first client.
Yeah,
and the training does teach that.
And Dan even mentions that it's one of many tools that we give out. Folks, we've developed about a dozen different ways that we teach people to go out and get clients. We know that that's the hardest part about building any business, unless you're just a sandwich shop and you open up and you put out a sign and people start showing up, This is one of those things that you have to actually establish yourself in your community as the expert. We're going to help you do that with some of the tools we're about to show you.
You bet. And one of those tools is just, we've got all the slide decks that you would ever need. Some people like to use flip charts. We've got that, but to just kind of walk the doctor through. Now, we'll show you actually not even how to show this to a doctor, but how to use people that you already know, what we call your warm market, people that you've already probably been in business with before, or you've gone to a chamber of commerce and they've gotten to know some people there. And you say, hey, I just want to share with you the new business that I'm starting here in 2022 in revenue cycle management, and go through this information. And they'll go, you know what? I know a doctor that could use your help.
Yes.
That's how it's done.
Well, and it's the best way to be introduced to a doctor. If you think about it, someone who already knows that doctor, maybe it's a financial planner or a banker, yes, or a mortgage broker. These are people who already deal with doctors. We show you how to connect with people in your community that already know the doctors. And some of them will say, yeah, I have a doctor that has even mentioned that he's struggling right now. So here's his name. And that's how we connect you with those doctors. And then we have the tools that you see here that will let you tell that story to a doctor that's very clear, very straightforward. We give you exact words to say. It's a system. Hey, that's why we call it American Business Systems. If you can follow a system, folks, you can be successful in this business.
And Patrick, it doesn't stop here. We're just not going to throw you out to the hungry wolves all by yourself. We will actually, our staff will get on with your doctor and share with them your findings of that practice analysis. We'll get the information, and we'll get online with them either through a go-to meeting or a Zoom meeting. And we're going to do the full demonstration of the software to share with the doctor how we come to those numbers that you discovered through the practice analysis. Patrick, I mean, whenever you've got experts of 27 plus years that's been in medical billing doing the demos for our business owners, our brand new licensees, that's how some of our brand new licensees are getting business within the first 30, 60, 90 days of becoming a licensee anyway.
Yeah.
Now, some take a little bit longer, depending upon if they're doing marketing full-time versus part-time, but this is how it's done. We're showing you exactly what you're going to be taught in that training.
Yeah, and we have licensees who basically have told us that 50% of all the demos that we've done for them, the doctors have done business with them. Folks, that's unheard of in any business, to show a demo of a product or service and 50% of the people buy from you. And that's what we're doing. We're there to answer all the doctor's questions. You can be on that webinar as well and listen to what we say and see exactly how it's done. And then eventually, Eric, as you know, most of our licensees eventually do those demos themselves because there's just not that much to it.
Yeah, absolutely. Yeah, eventually you can do them by yourself, not a problem. And then the third reason, you get to become the remedy. If doctor has pain and they need a source of remedy, you are able to be the remedy. And that's what we're going to show you through this. You're going to have business partners like Dr. Vicki Rackner or Adam Phillips. through the books that they're writing for you to utilize in your marketing. Why don't you share a little bit how Dr. Wagner does that and how ABS does that with some of the books that Adam's written and the books that you've written? You want to share a little bit about that, Patrick?
Here's the latest one, a book that we've published called 9 Ways Doctors Let Money Slip Through Their Fingers. And my son actually co-wrote this with Dr. Vicki Wagner. She was a general surgeon for many, many years. Now she is a conference speaker for doctors all over the United States. She consults with doctors and helps them build their practice. And so she said, look, let's put out a book that you guys can actually utilize in your marketing. Now, Eric, I don't know if this is going to show up or not because of my background here, but let me hold this book up and see if it can pick this up. Ooh, that's kind of weird, isn't it? It's because it's white and it's doing a weird thing there. But the book actually has up here in the corner, as you can see right here.
Oh, when you hold it up to your shirt, we can see it.
Yeah, it's a little sticker that we show you how to put right here on the front with your company name and web address and phone number, whatever you want to put on there, that says compliments of blah blah blah, your company name, and that way it's personalized and it ties you in with us and with Dr. Vicki Wagner. This builds huge credibility out in the marketplace. Eric, the other one is the New Thriving medical practice that Dan showed earlier that has their name on there. Oh, there it is. And as he's showing you there's the cover on the inside title page, and at the end of the introduction, we put your contact information right there. So it's a business card, Eric, that is just a fantastic way. Now, this is out on Amazon for $24.95, but don't purchase this, folks. If you want a copy of this, you can get a copy from your ABS representative, the person who sent you the email to this webinar. Just get back with them and say, I would like to see a PDF version of one of your books so I can see what's actually in it. And you'll see it's a powerful credibility builder for our licensees. So your name is right there on the cover. And you can write your own forward, or with our help, or we have a forward that's already written. Now, you notice the little stickers there. We do that because when we teach you to send this out to a doctor or leave it in a doctor's office for the doctor, we mark certain pages in the book. We highlight certain passages. So the doctor doesn't have to read the whole book. They immediately turn to these little tabs, you see, and start reading the highlighted, and it points out the pains that they're probably having and the solutions that we can provide. So it's a great marketing tool. And these books, Eric, even though it's $24.95 online, we can print these with our licensee's name on them for about $4 a copy. Yeah.
And so, folks, like Patrick said, this is the best business card you'll ever pass out
Right.
to anybody. And you get some of these part of your business package. Now, the business package includes the training. And the reason I say that is someone's asking, what is the cost of the training? Well, the cost of the training is all inclusive with all the marketing material that you're getting, the lifetime of support, all the different, 10, 12 different service lines that you have now. And Patrick, you want to share, currently what is the cost to get started here? I mean, somebody's asking here, so you might as well share that.
Well, it's like a franchise fee. You'll see this on our website. If you go to the website, you'll see there's a very clear explanation of what's included. But folks, it's like a franchise fee. It's $28,000 currently, Eric. I'm emphasizing that because at the first of the year, we will be going up on the price as we have over the years. It started out much less than that. But as we add new services and new revenue streams for our licensees, of course, the price goes up. So it is going to go up. We haven't decided what that's going to be, but it will be higher after the first year. So if you're thinking about starting a business, this is a good time to get started, and then your training can start next week.
Yep. And is asking, are there any monthly franchise fees you need to pay? And the answer is no.
No. In fact, folks, I decided when I started this business, I'm not going to nickel and dime people to death. Let's be upfront with people that there's one fee that you pay. Now, how do we stay in business and provide you with lifetime support? Well, it's very simple. we make a few pennies on all the transactions that go through our system. So you're not paying us anything, the doctor's not paying anything, but it's built into the fees that the doctor is paying you. And we take a small few pennies out of each one of those transactions. That keeps us in business, and we'll be in business from now on.
So taking a little wrap up here, that you're the solution. You can help those doctors lower those rejected claim rates, and they're getting those reimbursements paid within 7 to 10 days. Those are the two biggest things that you'll learn during the training of what makes you the solution. Now, you can see here, what the denial rates are and how they've been in comparison. But Patrick, I know we're running it just short on time here, so I'm going to get on to the last part of this. And the biggest reason that you're going to want to start your business with a company like American Business Systems is because ABS is going to be your support for a lifetime. Now, let that sink in. There's no additional fees for additional support. You're going to get lifetime support from ABS.
Yes, this is a picture of one of our support centers out in California. We have them all over the United States. And some of them, of course, are run by, we've got support people literally working out of their homes in different, but it's all US based. Let me emphasize that.
Yeah.
And it's lifetime support. Now, folks, you realize how important that is, because as you do those practice analysis, we help you and go through to help you with the pricing and give you suggestions on that. And then we have a licensee support site that we're showing you right here that is one of those sites that has thousands of documents, videos, and all kinds of stuff.
And then the full suite of everything with the actual billing platform, it's got its own billing system, electronic medical records platform. Some of you heard me say something a little bit about a clearinghouse this time. We didn't get a chance to go into that much today, but that's actually built into our system. You don't have to go find a third-party clearinghouse. That's what makes our system so different than any others. Plus, it's got its own patient portal. It's everything that you have and everything that you need. And Patrick, AB here, you say, is here to train.
Yes, in fact, there's a picture of our lead instructor right now, Cynthia Anderson, her name. She is a licensee. She's been in this business for 10 years now, Eric. Yeah, it was 2000, whatever that is, 10 years ago.
I think it's been longer than that. She's been around for quite some time.
Yeah, and she has built a huge business. She has employees. She's got clients all over the United States. Eric, this lady is a very sharp business person. She's the one that teaches you. Of course, we pay her a fee for that, but you know what? She does a tremendous job. She used to fly down here and do it here live, and now it's one-on-one with you and your spouse or partner from anywhere in the United States.
Yep, and we've got ongoing training, motivation. We have weekly, sometimes weekly, what we call business owner or licensee webinars outside of what you're going through today. This is just to get you as much information as we can. But once you become a business owner with American Business Systems, we have motivational webinars and ongoing training that happen just all the time. And I'm going to close out today by saying, if you haven't seen your own live demo of iClaim and EMRX, get back with the person that invited you to the webinar today and get that scheduled. Take the time that you've got a little bit of time off from the Thanksgiving holidays over this next few days and get with them, and they'll be happy to get that set up with you. So is 2022 a good time to start a business, Patrick?
It's the very best time. In fact, people ask me all the time, well, what is a good time? Well, the best time is when you don't have a business, if you don't own a business, or if you haven't gotten your pink slip yet at work. It's just a matter of time, folks. There is no security in working for other people. You've probably found that already if you've had a job for very long at all. Can you do the business at home? Someone's asking here, Doris. Yes, Doris, the business, in fact, most of our licensees are working from their homes. The doctors don't care where you're working from. We show them basically that we can do all of this remotely, just like they can see their patients remotely. So there's the price of the licensee. The increase is happening on January 1st. And folks, I want to also point out that Cynthia's time is limited as well. Right. So if you basically want to get started in this business and get your training started, the faster the better, because those slots do fill up where she doesn't have time. She might have to put it off for a week or two before she gets started. But right now, Eric, we do have slots open. I guess maybe it's because it's the holiday period, but people are basically slowing down and doing their due diligence and so forth. This is a good time to connect with us. We have a downloaded research guide. Let's see, I have a copy of it right here that I printed out just so you can see, but it's over 60 pages now of information that you will not see on our website. You have to ask for that because we want only the people who are serious about looking at this. Get back with the ABS rep. There's our phone number. There's an email address. If you don't know what else to do, just email us and say, who's my rep? And I want that research guide. Then browse our YouTube channel. Yeah, there it is right there on the screen. It's youtube.com/YABS. I'm going to get my little annotation tool here just so I can kind of mark that for you. And there it is right there. And then ask your ABS rep for a reference list. Yes, as Eric mentioned earlier, we have licensees who are willing to take a call from you. These are people who've been in our business and they're already very successful, and they can tell you exactly what they experienced going through the training and so forth. Then ask for a live demo that Eric just mentioned of our iClaim EMRX platform. Folks, this is not a sales pitch. This is a demo. All we do is show it to you and let you ask all the questions you want. Then lock in your first live online training session with us, and man, you're off and running. All right, well, I mentioned the money back guarantee. Folks, we're the only company that I know of. In fact, we're the only franchise I know of that offers a money back guarantee. If you go through our training and you don't like what you see, it's real simple. Just ask for your money back and we'll give you all of that back. There it is right there on the screen. Eric, put it up there for me. Thanks, Eric. Excuse me, I had to get a drink of water there. Okay, so folks, this is one of those things that you have to think about. We know that. We don't try to sell you here today and close you out or anything like that. We want you to do your due diligence. There's people who've been on these webinars for weeks, sometimes months, before they can come up with the funds and do the research that they need to do to make a decision. That's fine. We'll be here another 27 years, hopefully. One of the questions is from Joan. She says, does the doctors have to pay subscription fees? Yes, that's part of how we make our money, Joan. On the back end, as I said, is we make a few pennies on each transaction. So the doctors are paying a subscription fee for them to have access to our system. And of course, that gives you access to the system to do the billing. It gives them the electronic medical record systems if they sign up for that. And so ask your ABS rep to go into a little bit more detail on that. And you'll see it's very reasonable, the fees for a doctor. And there's one other question here. If my spouse takes the seminar training with me, will he get the license as well? And do we need to pay extra fee for this? No, that license fee of $27,990 is the license fee. You can have as many partners or spouses that you want on that. Hopefully you don't have but one spouse. But if you had more than one, they could be on there too, again, from any device that connects to the internet anywhere in the world, just like you would do any other Zoom meeting. And no, there's no extra fee for that. So they also get the license. They also get the certification. That's right. Anybody that sits through the training with you through all the 10 sessions, they get that certificate as well. Well, folks, we'll let you go then. Hey, if you got any other questions, type them in here. We'll get back with you through email and answer those questions. Thank you for being on this today. And we hope that you sign up for our other webinar that's coming up next week. Just go back to our website and click up there at the top where it says attend a webinar, and you'll be able to sign up for that one as well. Again, thanks for being on here, and I hope I see you on our live training sessions. I will make a personal call to you if you do sign up, and we can talk a little bit before you get the training started, and then we'll talk after the training and see how you liked it. So again, my name is Patrick Phillips. I'm the founder of ABS, and I'm glad that you were on here today. Thanks again. We'll see you next week, hopefully. Bye for now.